First, a little bit of truth, distortions, lies, so forth. You have to understand that socialized medicine is the holy grail of the progressive movement. And if you think progressive means progress, you have to understand that the progressive movement is a pseudonym for the Marxist movement that began around 1900. They needed another name for it because Marxism was really falling out of favor with the fall of Russia and so forth. So progressive is the word they chose to make me think of progress. Nothing progressive about it. It's actually a misnomer. It actually wants to take you back to a monarchical, fascistic system that was very popular in the early 1900s. So this is the holy grail. The British health system was the first one, 1911. Then comes the Nazi system, the National Socialist Party of Germany, in the years running up to the Holocaust and so forth. But it is ideology. It is not about what's good or bad or anything else. This is ideology, and this is the way that it's always going to be spun. So there's no problem with the people pushing this ideology lying to you. They don't care. So here's the big lie of all. I'm running for office, and I'm going to tell you, you can have all the health care you want. You can have it whenever you want. You can have as much as you want. You can get it from any source you want, and you don't have to pay for any of it. That's my campaign promise. Now, who's believing here? I don't see any hands going up. That is exactly what the electorate is being told. It's a flat-out lie. Everybody in this room knows it's a lie. It doesn't work that way. It can't work that way. It never will work that way. That's the big lie. Okay, how about this one? The World Health Organization says that, healthcare in the United States is middling to poor, or whatever. Infant death rate is high, yada, yada, yada. The World Health Organization that gets quoted, and when somebody quotes the numbers from the WHO, first of all, you have to understand, it's an ideological organization. Second of all, those numbers are 10 years old. Thirdly, they have been widely discredited over and over and over again. And I'll give you a for instance. Basically, in this country, one of the stats is infant death. Bad infant death ratio in this country. Well, we count infants who were born under extreme circumstances that we tried really hard to keep alive. And we're the best in the world at keeping infants alive, and we're really good at it. Nobody else is anywhere near as good at it. Other countries, it's called a bucket baby. Doesn't look like it's got a chance in the bucket. They don't count those. That's not an infant death. So there are your statistics right out the window. And this has been shown over and over again for all the WHO stats. There's another organization now that's taken over for the World Health Organization that began as a socialist union of European countries that now includes countries elsewhere, and they periodically put out these same kinds of quote-unquote facts. You hear these facts touted around as if they're true. They're not. I mean, the simple truth is, if you get cancer, the place you want to be in the world is here. There's no question about it. Our survival rates are many, many, many years longer than anywhere else in the world. I mean, there's no question that you can get the best in this country from the healthcare system. Are there problems? There absolutely are problems. We're going to get into that in a little bit. But when somebody comes to you and starts quoting those two sets of stats, you know you're dealing with a liar. Or you're dealing with somebody who's either uninformed or doesn't understand what they're saying. It's just stupid. And that's not uncommon either. You see that a lot with media types, and you see it a lot with politicians. They simply trot out a number they've been told, and they don't understand that it's not a valid number. So this is still part of health, sort of house cleaning, if you will. How about this one? You can't get health care in this country. People don't get it. They don't get health care. Okay, 1996, something called the no dumping law was passed. Colossally bad law. But anyway, basically it says hospitals can't turn away anybody for any reason. You show up at the hospital, you get treated. There's no check of your wallet, what we call a wallet biopsy, to see if there's money in it. There's nothing like that. You show up at the hospital, you get treated. It's the law. It's been the law since 1996. More importantly, it has been the ethical and moral law of the delivery of health care in this country back to its inception. I mean, it has always been true. Now, when they passed the law, what ended up happening was some pretty poor hospitals began dumping patients, which is one of these things that happens with unintended consequences of government action. They come through, they think this is a great idea, we'll pass this law, and then somebody out there says, well, we'll figure a way to get around it. And so there is some dumping of patients out there, but the truth is, everybody in this country, if they can get to a hospital, they get health care. They get very inefficient and expensive health care, often much more spent on them than spent on you, but nevertheless, they do get health care. So it's just a flat-out lie to say they don't have access to it. They do. Okay, how about there are benefits already to the ACA. Now I'm going to use interchangeably the PPACA, PPACA, and the ACA, and the PPACA was Patient Protection and Affordable Care Act. They used that to replace Obamacare when Obama realized he really didn't want to own it anymore. But Obama launched Obamacare, and then he decided he didn't like that name, so he switched it to PPACA. And now, since it's not really, it turns out it's not really Patient Protection and Affordable Care Act, now it's just the Affordable Care Act. So all three are interchangeable. It's the same law. So anyway, benefits. Okay, your kids can stay on your plan up to 26 years old. Everybody heard that one? Okay, that's a benefit that everybody out there likes because it's a good benefit and so forth and so on. Well, Blue Cross Blue Shield of Delaware has always had that policy. That's nothing new. You know, one of my kids just turned 26. We knew 5, 6, 7 years ago when he started the college game that he could stay on our insurance plan. ACA had nothing to do with that. There isn't any, but nobody can trot out a bunch of kids who are still insured because they're on their parents' plan because they were already on their parents' plan. They didn't get added to the rolls. If you talk to the insurance people, there wasn't any addition to the rolls. Now, the insurance premium went up because the actuaries had to factor in as if it was going to be an increase in coverage. So the premiums went up, the maximum that were allowed, but the fact is nobody got extra coverage. So it's just simply not true. I'll give you an example about one of the net effects of the ACA passing around access to care. When a small businessman who's a doctor looks at this legislation and reads it, as I have, and sees what it does 5 years down the road, 2 years down the road, 10 years down the road, we start to make changes. And since we're independent groups, we change what we're going to do, how we're going to do it. In the state of Texas, in response to the Affordable Care Act passing, the number of participating doctors in the Medicaid program dropped almost in half, from about 42-43% dropped down to the mid-20s. So doctors said, I don't think so. You know, I was doing this. I was taking care of the Medicaid patients, but under this set of circumstances, I don't want the risk. I'm dropping it. So the access to care is already starting to be limited. People are starting to say, no, I don't think I want to stay with Medicare. I'm not going to stay with Medicaid. I'm not going to do that. So, and that's where the rub really starts to kick in. Ultimately, what rules is supply and demand. And this is one of the reasons that I serve with the Caesar Rodney Institute, because it's one of those organizations that really gets it. You want something to happen, you provide an incentive, people will follow that incentive. Supply and demand is a law that just flat out works. When the government tries to mess with it, people find a way around it. They do workarounds. Supply and demand always plays out. So as Enoch Powell said in the British Parliament in about 1968, if you make medical care completely unlimited to everybody, you will have ultimate rationing. In other words, you can't mess with the supply and demand curve. You can't. When you're going through the woods and you take a wrong turn and you get lost, taking 5 or 6 other turns in succession is not going to get you unlost. You're making a bad decision based upon a bad decision. You're never going to get there. You've got to go back to the root cause. Okay, what's the root cause of the problem with healthcare in this country? Turns out it's government. Yeah, surprise, surprise. It's somebody trying to think that they can, just figure the whole thing out and tell us what to do. It'll all work out. Okay, we're worried in World War II about basically issues of inflation, deflation. So they do the simple thing. They put in wage and price controls. Now, this room certainly remembers Nixon's wage and price controls and what it did to the gas lines and all the rest of that. So, first time it really happened was FDR, World War II. He freezes wage and price. Manufacturers, businesses, everybody out there saying, okay, we cannot give you a raise. We're not allowed to. But we'll do something else for you. We'll pay for your health care. How about that? People go to work for your company. You're going to pay for their health care. Gets around. It's a workaround. So we're going to give you health care. So in comes this era of essentially the Blue Cross Blue Shield network, which was around, but it was community by community. It was very small. Communities were risk pooling with each other for good reasons. They generally had a charity hospital and a private hospital, but they were risk pooling on a local level. In comes health insurance. So guess what? Everybody who's working now within a very short number of years, 10 years, everybody who's working now has health insurance, and they don't have to pay for their health care because the insurance is paying for it. So now you've disconnected the service from the person who's paying for it. So it's a free all-you-can-eat buffet. Well, I mean, you're not going to get charged for 6 steaks at the end of the cafeteria line any more than 1 steak. So take 6. What the hell if you don't eat them? There's a complete disconnect. So that's the first thing that happens. Okay, so all the people who are working, they don't care. They'll get any kind of health care they want because they're not going to have to pay for it. They've got insurance. So guess what the doctors and the hospitals do? They charge more money. Guess what? Because I used to charge you $2, now I'm charging you $15. You don't care because you're not paying for it. So I charge $15, and the insurance company pays it. They don't know. They're just shifting money around. So guess what? You get hyperinflation of healthcare costs. Actually, inflation at that point because it didn't really happen in a hyper way until the next problem comes along. All the working people have now driven up the cost of healthcare because it's quote-unquote free. What happens to the retired people? And by the way, retirement is a concept that only gets introduced into this country post-World War II. Before World War II, people did not retire. You dropped dead, you did a lot of other things, but you didn't retire. Retirement simply wasn't a concept because there wasn't anything out there to live off of. If you're a farmer, you farmed until you couldn't farm anymore. Whatever you were, but there was no retirement. Retirement is a concept that kicks in the 1950s. Excuse me. So here you've got this population of people who are driving up the cost of healthcare because they're not paying for it, and you have all these old people. All of a sudden, the old people are now getting destitute. They've got to actually pay the same price that all these people are insured for. We can't have that. We can't have all the old people in the country poor. I mean, that's not right. They've worked all their lives and so forth. We can't have them poor. Medicare. We'll create Medicare. Late 1950s, early 1960s, along comes Medicare. Because we got to cover this group that's not covered by their insurance where they work, because they don't work. Okay, they're too old to work. So now we got Medicare. When Medicare comes in, now you get hyperinflation. Now the cost curve's going like this. The cost curve goes like this. It gets really steep, really fast. Tons of money gets poured into the science of medicine. Tons of drugs get invented. MRIs, CT scans. All this stuff gets invented, all these prosthetics that I put in, the hip and knee replacements, all this stuff gets invented. The price is unlimited because Medicare is paying for everything. There are no cost controls on that. So it's hyperinflation. So now, ultimately, you think, well, why didn't it all explode early on? Well, the first thing that had to happen was a couple other groups had to get disenfranchised. Who's the next one that gets disenfranchised? The children. We'll add another program, CHIP. S-chip, okay, the children's program. That takes care of those people who are neither too old nor working. So we got CHIP in there now. What about those people who are just really destitute? The really bottom scum of the population. Let's cover them too. Let's call that Medicaid. And we'll start with directing that only at 2 or 3% of the population. Well, a little bit more than 2 or 3% of the population now, I can tell you. Okay, we'll throw in a couple others. There's, of course, the NHS and the military health system and the VA system. These are all government health care programs. The best one, Indian Health Services. Love this one. Indian Health Services. Before you're born, you're a member of Indian Health Services. Your prenatal care is done by Indian Health Services, not by somebody that they contract to, by Indian Health Services, who pays the doctors. I mean, you are an Indian Health Service doctor, that's all you do. Cradle to grave. The only system in the United States where cradle to grave, you're a member of the Indian Health Services. Okay? The others you come in and out of. Medicare you get later on, your Blue Cross Blue Shield or Aetna you get while you're working. You come in and out of these systems. No, Indian Health Services, cradle to grave. Average life expectancy, according to the Indian Health Services, this is according to the government agency itself. Average life expectancy for somebody in the Indian Health Services program is 6 years younger than everybody else. In Arizona, they ran the statistics where they have a lot of Indians. The average lifespan in Arizona of Indian Health Services is 59 years of age. That's how long they live. Average of everybody else in Arizona is 77. So let's see, if you're covered by the government through, thank you. If you're covered by the government, cradle to grave, with one of these health systems, and your life expectancy is 59, and everybody else is 77, let's do that math. That's 18 years younger when the government is providing your health care. 18 years, that's a little bit of a difference. I'd be upset if it was 18 months. I knew there'd be some Indian subgroup out there complaining about 18 months. But 18 years? So here you've got all these groups, and that combined with state and federal workers whose health care is purchased by the government, you're up to about 65% of the population. None of those systems are functional now. None of them are solvent. And the ACA basically says, well, if we only had control of the last 35% of the healthcare industry, then we'd be solving everything we'd find if we just got that last 35%. Well, let me get this straight. You're screwing up 65% of it, and you're going to ask us to expand your business so you have 100% of it to screw up? I don't get the math. And if you're doing a bad job managing it now, why should I give you more of it to manage? I really don't understand that, but that's where we're going. So here's the deal about repeal. You have to go back to the index mistake. You've got to get skin in the game. You're never going to get control of costs until people start asking, what does that cost? How much do I have to pay for? Do I really need that test? Why does 17, 18 cents of every dollar I pay go to protect you from a lawsuit from lawyers? Well, what are they doing in here? What value are they bringing to this equation? Is there value added to tort lawyers? Are they really helping? Well, you can peel down that onion lots of ways. One way to peel it down is you save $16 billion immediately by tort reform, the same way a couple of states have done. After you peel down that's just the unnecessary testing that's done to protect the tester from the lawyers. After that, you get all sorts of other benefits from no complications from the tests to tons of other things. It's in the hundreds of billions of dollars by anybody's estimation. So why repeal? First of all, because the numbers we were told, $1 trillion, is a lie. Buried within that $100 trillion was $100 billion, which was supposed to come in. Sorry, I apologize.
Take two F.
I must have picked up some pollen out there or something. One big part of the Affordable Care Act was was something called long-term health insurance, which on the face of it sounds great. And the idea is this: we're going to ask young people to buy into a program of long-term health insurance. They're going to kick in $100 billion because they're going to want to buy into this. We're going to take that $100 billion, add it into the Medicare, and we're going to make all the numbers work. Well, over a year ago, Kathleen Sebelius quietly canceled the program. And the reason she canceled the program is that young people didn't buy in. They looked at it and they said, this is BS. I don't have any interest in it. So nobody bought it, so the program failed. That's $100 billion right off there. So already your budget's shot. Then there's the issue where, of course, the Supreme Court said that they can't mandate the Medicaid expansion. That basically kills it another way. There's the little fact that the Medicare premiums, formulaically, are going to double in 2 years. Now, did you guys know that? Does anybody here know what they pay for their Medicare insurance? I see a lot of people here on Medicare. You know what you pay? Do you know how you pay it? It's taken out of your Social Security check, right? It's a deduction. It's not like it comes out of your wallet. It's taken out before you ever get it, right? Do you know that it's doubling in 2014?
Yeah.
You know that?
Yeah.
Doubling. Yeah.
Yeah.
Well, you know, that's an interesting phenomenon and I'm talking to you folks on Medicare. You know, a lot of people are pointing fingers saying, well, you know, you're the problem. Why don't you just, you know, get on with it? You know, get out of the way. Call the herd. Quit spending all our money. You guys paid into Medicare. You may not have paid in as much as people are now, vis-a-vis the benefits they're going to get. Incidentally, last year was the turning point where people will get less out of Social Security than they paid into it. But Medicare is the same way. The truth is, you guys at least paid into Medicare. You bought this service that's now being taken away from you. Oh, and by the way, January 1st, if things stand the way they are, Medicare reimbursements to doctors, that's Part B, drops 27%. I don't know who runs the business here. I don't have a 27% margin. I don't. I simply don't have a 27% margin I can give back. The following year, it's another 3%, 30. The year after that is 33%. So by 2016, you know, I'm going to be paid a third less, 33% less than I'm paid now to do what I do. I don't have that kind of margin. So what do? Well, I stop seeing those patients. That's what I do. And then still I take care of the Aetna and the U.S. Healthcare and the Blue Cross Blue Shield or whatever else that I need to, but I can't. I can't pay my staff. I can't pay the electricity bill. I got a 33% margin. So anyway, that's where you're heading. You're heading towards abject rationing. And that's why you gotta go back to the very beginning. You gotta get the generalized costs down as hard as you can. Let's talk a little bit about Delaware. There's something called HB 392. Anybody here know about that? Do I have the number right? Yeah. HB 392. HB 392 basically says if the Affordable Care Act, if Obamacare fails, we will implement in Delaware a single-payer system. Single-payer system basically means that through the state, all fees will be paid by the state. There will be no private insurance. They're going to ban private insurance. So your industry, your insurance industry is going to go away. The insurance industry is generally speaking painted as the demons with the malevolent intent for all of us. Insurance people want to make a profit. Everybody wants to make a profit. But they also are the people who calculate the risks and figure out how to distribute those risks in a way that does make things very consistent. So they do provide a service. Well, they're going to go away with HB 392. They're just going to disappear, and the government's assuming going to tell you what you can and can't have. Which scares the hell out of me, considering I've yet to meet a really competent collection of government people. So HB 392 is temporarily, so we hear, is temporarily shelved, depending upon really the outcome of the election. There's some thought that HB 392 is simply a straw dog that's being set up to see what kind of people come forward to oppose it, to provide political fodder. It may have something to do with the fight for the insurance commissioner of the state. That may be part of what it is. It may have something to do with Jack Markell's ambitions for Washington. And there's a very strong suggestion that it's actually coming out of Washington, with Delaware being served up on a silver platter by our vice president as the first state that to be picked off after Massachusetts. But any way you look at it, HB 392 is a terrible bill. It's poorly written. It's being proposed by a couple of people who really don't propose bills, so we don't know how they got it. We don't know who wrote it. But be afraid of it. It's not going away. It's part of the ideology, and you're going to run into the ideology one way or the other. The way the bill certainly stands, ACA Affordable Care currently stands, by 2016, there will be no private insurance. You won't be able to buy it. Your employer isn't going to be able to buy it, so it won't be there. And I have yet to run into anybody at any level who knows the industry, and these people in the insurance industry, who dispute that. Nobody disputes that. When I say that, nobody comes forward with me to dispute that, ever, 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 ever. It will disappear in 2016. So then what are you left with? And this is the waiting game that happens. You don't repeal the bill, you just sort of let it sit out there, you defund it, you make it so it can't really do what it's supposed to do, but it sits out there, and it sits out there, and then all of a sudden all the alternatives go away. So then we get into the predictions. What happens then? What does the healthcare delivery system in the United States look like then? We have to look at incentives. What are people going to do? People are going to follow incentives. They always follow incentives. So the doctors who can retire will retire. And most of the time, I don't know many doctors who are, over the age of 50, who under arduous circumstances wouldn't be able to retire. They could retire. I mean, they're 50. Most of us like doing medicine. We don't want to stop doing it, but we could retire. I could certainly retire. Make it uncomfortable enough for me. I could retire. I'd give up all my friends or my patients that I get to see every day, but I could retire. Most of us could. So that happens. Then there's another group that says, I can't afford to continue to serve in this way because there's no money in it. I can't pay off my debts. Yada yada. What do? Well, they work for cash. That's the way the British system works. If you want a hip replacement in Great Britain, you're going to wait about a year, see an orthopedic surgeon, and then after that, you're going to wait about a year and a half to get on the surgery schedule if you meet the criteria. So people who want a hip replacement, they either come to the United States and get one, or they go to a private doctor in Great Britain and pay for it and get it. So in Great Britain, you've got the national health system, and then you've got a private system. A friend of mine went in, had cancer, was told that he was going to have to wait 18 months to get the cancer treated. Went home, mortgaged his house. This is in London. Mortgaged his house, got the money, went to find a doctor to treat his cancer, ended up going to the same doctor, same exact doctor, was treated immediately. That's the difference. So our question facing us is when we develop this, pay-to-play system, which will happen, it will absolutely, positively happen. You've got the money, you can get what you want, and everybody else is going to just get in line. When that happens, is that the kind of country we want to live in? That's the way all the socialized countries are. Canada's a little different because it's illegal to do that. So in Canada, you just wait. And it's about 18 months. I happen to know a lot about hip replacements because that's what I do, but it's about 18 months to get a hip replacement in Canada. It's about a year to get injections in your knee in Canada. You got to wait about a year. So it's funny because you can buy the medicine really cheaply in Canada. So I've got a couple of Canadians who buy the medicine up there really cheaply, bring it down to Delaware for me to inject their knee, which I find kind of comical, but that's how they can get it done. But Canada's an aberration, and they have their problems. All the socialized systems are bimodal. They have a rich people system, and then they have an everybody else system. And we haven't evolved that yet. But that's one of the reasons I think you kind of need to go back to basically a root cause analysis. You get people skin in the game, you get communities that care for each other, you get the federal government completely out of it. They've botched everything they've touched. They constantly have unintended consequences of their laws that just create another problem 10, 15 years later. You do local risk pools rather than everything the same for everybody. For instance, the health care that's needed in Oklahoma is not the same health care package that's needed on the Upper West Side in Manhattan. It's not the same. You need different things in different places. Local communities can do that. I don't think the federal government can. I think it disconnects us from the essential job of taking care of our fellow man locally. So anyway, that's my take on it. I think you go back, you repeal the whole doggone thing, and start from scratch, and rebuild it with some sense.